Hi there, this is Dr. Funke Afolabi Brown. Welcome to my channel. I'm the founder of Restful Sleep MD. The last episode, we talked about what the common symptoms are of children with obstructive sleep apnea. Again, obstructive sleep apnea is a serious condition that can be seen in kids where you have complete or partial upper airway obstruction. And we talked about the different symptoms you can have in children with sleep apnea, including snoring, which is habitual and occurring outside of colds and allergies and things like that. And we talked about some other symptoms like the daytime and nighttime symptoms of obstructive sleep apnea. And so today, I wanted to talk about how obstructive sleep apnea is diagnosed. So, for example, you have a child that's snoring frequently and has some of the symptoms I had talked about. If you didn't watch that episode, then it would be helpful to just look it over. What are the symptoms of OSA? That's the title. And so essentially, you've gone to your child's doctor, and they feel that your child needs to get tested for obstructive sleep apnea. And so the way we diagnose OSA, in addition to symptoms, is by a test called a sleep study. The other term for it is a polysomnogram. Okay, so essentially what a sleep study is that your child will come to a sleep lab. Usually, the sleep lab should be accredited by the American Academy of Sleep Medicine. And so they come in and get the sleep study or sleep test done. That sleep study is a non-invasive test. And essentially what's happening is that your child is monitored through the night. So they come for a sleepover. And so they'll come into the sleep lab. They'll come in, with their PJs, pillow, just come in trying to give a similar scenario, a similar condition to how they would sleep at home. And essentially what happens is they get monitored throughout the night. So there are different parts of a sleep study. They're going to have stickers that are put on their hair, on their head, so it can monitor their sleep essentially through the night, their brain activity. This way you can tell when the child is asleep versus when they're waking up. And then there are other parts to the test, including a pulse oximeter, which is used to measure oxygen level. They also sometimes will measure carbon dioxide levels. They'll measure the airflow. This way you can tell if your child is having the obstruction that occurs when you have apnea. And then we also have some belts that will help us see if your child is breathing, if they do stop breathing. Then another part of the test is used to monitor their movement. So if they have a condition called restless leg syndrome, you may be able to see based on how restless their sleep is. So these are the different parts of the sleep study. Again, it's non-invasive. Usually, you can ask your doctor just for more information as well. And nothing hurts. After the test is done, it's done. They'll come in the evening. They'll leave in the morning after the test is done. And then it takes a little while, sometimes 1 to 2 weeks, depending on where the sleep study is done, for a sleep doctor to interpret the study. And then based on the findings of the study, based on, for instance, how many times they had the apneas, how many times they had their oxygen levels go down, we'll be able to grade the severity of the sleep apnea. We'll be able to tell if there's sleep apnea or not. So the way sleep apnea is graded is based on just how many apneas and obstructions they have over the course of the night. And so you have what you call mild sleep apnea, moderate sleep apnea, and severe sleep apnea, just depending, which kind of shows you the level of severity. So this report is then sent to the doctor that ordered the sleep test. And then based on that, they may need to be referred to the ear, nose, and throat doctor if they do need surgery, or if there are other treatments that they may need, in which case they would need to see a sleep doctor as well. That's always something that we recommend. And so those are just the different parts of the sleep test or the polysomnogram. Now, again, like I mentioned, in children, it's done in a sleep lab, which is an accredited sleep lab, accredited by a foundation called the American Academy of Sleep Medicine. There are home sleep apnea tests. Those have been done and studied more in adults. There are definitely studies that have been done in children with a home sleep apnea test, which would be more convenient because it will be done in the comfort of your child's home, a little less anxiety provoking and things like that. It's also definitely cheaper than a test that's done in the sleep lab. However, even though there's some studies that have shown that home sleep apnea test can be done in children, it's not as comprehensive as the sleep lab sleep apnea test. And so as a result of that, the studies in children have not really been, they're kind of limited. So we don't have as much information about home sleep apnea tests in children as we do in adults. And so even though some studies have shown that it's feasible, even though some studies have shown that you can diagnose sleep apnea based on the home sleep apnea test in children, it's still limited. And so it's not routinely done. And especially in some children who have complex sleep disorders or children who have underlying syndromes, the home sleep apnea test may not be as accurate in detecting sleep apnea in those group of children. There's a lot of research that's going on to study this further. So what I would recommend, again, speaking with your physician, is if you have a concern your child has sleep apnea, that the test be done in the sleep lab where you know that it's done accurately and the results are more reliable. So if you do, again, have any concerns your child has sleep apnea, that's one of the things I want you to realize is there are ways to diagnose this. And the first step to take is to speak with your child's doctor so they can guide you on the next steps. I hope this has been helpful. In my next video, I'm going to be speaking about how do we treat sleep apnea? What are the different options available for sleep apnea? Can we just wait it out? Is there, are the treatments similar to adults? Will they need CPAP? Just stay tuned and we'll talk a lot more about this in the next episode. If this has been helpful, I would like it if you like my video, share and comment, and definitely subscribe to my channel. This way, as soon as new content comes, you'll be the first to know. See you next time.